Welcome to the Heart of Healthcare podcast. I'm Halle Tecco.
I'm Michael Esquivel.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all. Hello, listeners, and welcome back to the Heart of Healthcare. Today is your digital health download for December 2025. Michael and I are here to break down all the latest headlines in health tech. We have a lot to cover today, including the first trillion-dollar healthcare company, a big CVS Oak Street Health write-down, a digital health founder going to jail, and so much more. Michael, how are you, and are you ready to get started?
Well, first off, happy holidays, Halle,
Yes.
and happy holidays to all our listeners. Hope everybody's getting set for a wonderful season ahead.
Yeah.
So let's kick it off. A topic that you know is near and dear to my heart and one of my favorite segments in healthcare, longevity, which is seeming to really have a moment. There's two recent funding events I wanted to chat about today, Halle. First, you probably saw Function Health announce that it just raised a $298 million Series B, valuing the company at a whopping $2.5 billion. As our listeners know, they offer members comprehensive lab testing. They consolidate those results from EHRs, wearables, and scans, and then run all of it through an AI model trained by doctors. The company claims to have done 50 million lab tests since 2023. Plus, they have access through their partnership with Quest to 2,000 Quest sites. So that's the first one, Halle. The second, by contrast, was an interesting one, Blueprint, which raised $60 million entirely from over 50 angels. So there were zero VCs, zero institutional investors. Blueprint, as many know, is betting on longevity protocols and biomarker tracking for consumers, stuff like optimizing sleep, metabolic health, inflammation, and so on. So the traditional CAC for health companies like this one is $200 to $400 plus. Blueprint, by contrast, is trying to get that down to $0 by turning their cap table of angels into their channel strategy. What do you think, Halle?
Yeah, I mean, I saw both of these stories. And as you know, I'm also a big supporter of direct-to-consumer products. I mean, these are polar opposite strategies for fundraising and kind of symbolic of the two edges right now. You know, next week, our listeners will hear the episode that we did with Emily Melton and our recap of 2025. And kind of the big takeaway from her was like fundraising in 2025 is like the story of the haves and have-nots. And these companies are obviously the haves. We're seeing these mega rounds led by mega funds like Andreessen, which back Function. And then there's Blueprint, which is actually the first I've heard of like a round of all angels. Michael, you've managed so many cap tables. I'm not sure if you've heard of this before. They recruited just like a bunch of celebrities to launch their longevity as a subscription product. You know, CPG in general is out of fashion with investors, but this one is really proving to be unique. And Brian Johnson's branded products that he says he's done all of the research on to bring to consumers to help them live longer is interesting. But the one thing both of these companies have in common is a famous founder. Right. So we know.
For sure.
Yeah, we know.
Sure.
Everybody knows Function Health is founded by Dr. Mark Hyman. He's a wellness influencer. I don't know if everybody knows who Brian Johnson was before he became the Don't Die influencer. But before this, he was the founder and CEO of a fintech company called Braintree, which acquired Venmo and then later sold to PayPal for $800 million. So both of them super wealthy, high profile founders that kind of have put their name behind these products.
Yeah, this is the first time, Halle, you're absolutely right. I mean, I am accustomed to seeing, especially where there are celebrities or influencer types, initial seed rounds, and they tend to be in the 5 to 10, maybe $15 million range. But this one at $60 million entirely from those types is one that I just haven't seen, at least from recent memory. And so very, very different strategy for sure. And it's interesting because Brian's doing something a little unique. He's not only bringing these influencers and celebrities to his cap table, but he's turning them into that channel strategy. So it's a really fascinating approach, and obviously very deliberate on his and his team's part to structure it this way. But that is definitely a unique one. Yeah,
I wonder if they have like additional shares, advisor shares or something in exchange for the promotion, or that was just part of the term sheet. Because I know a lot of times these celebrities will come in, they'll invest alongside the VCs, but they'll say, actually, to use my name, I need additional, advisor shares. So I'm curious how they arrange that. And I'm also curious, Michael, have you tried either of these products?
I have not. Although, as you know, I'm very steeped in this from a personal perspective and a metrics and measurement and supplement and try new things here to learn about how my body reacts to different
Well,
different
apparently,
protocols.
I watched the Brian Johnson documentary.
Oh, you did? You did catch it?
I did. It's intriguing. It's very interesting. But the thing that stood out to me, the one thing that I remember was that for 6 months straight, he had a 100 sleep score on Aura.
It's just
so
amazing.
I don't know. I'd buy whatever he's selling if they can get 100 sleep score. I don't know. Maybe it's like anesthesia every night.
I think turning your sleep into a routine, obviously, but also just following whatever steps he's taking. For me, just the reality of day-to-day living, it's hard to have that kind of consistent commitment. And so it just takes, an emergency, a client emergency, something of that sort to really, really wreck that approach. But what he's doing is clearly working for him, and I wonder through Blueprint if he's going to be able to sprinkle some of that magic on the rest of us.
Yeah. All right. Well,
times. Yeah. Fascinating times.
Yeah. Well, let's talk about the first $1 trillion healthcare company.
Woo,
so
woo.
This time last year, there were 7 public companies worth $1 trillion, mostly tech companies, Apple, Amazon, Alphabet, Meta, et cetera. Now there are 10. So we got 3 new ones this year. And just last month, the first healthcare company joined the $1 trillion club, Eli Lilly. This is the Indianapolis-based 150-year-old pharma giant, which is valued at $1 trillion, up from $150 billion just 5 years ago. And just for comparison, Johnson & Johnson is the next most valuable healthcare company, and it's worth half that. And United Healthcare is $290 billion. And obviously, this is thanks to the GLP-1 weight loss boom. They are absolutely printing money now. Their drug Zepbound, which is the same molecule as Mounjaro, just different label for weight management versus diabetes. It's on track to become the top selling drug in the world this year. I don't think there was a month this year where on the Heart of Healthcare, we didn't discuss GLP-1s on this show.
It is crazy. It really shows the power of these drugs. It's fascinating. For a while there, Novo Nordisk and Eli Lilly were sort of competing head to head. Yeah. But it sounds like as the data showed over time that there was a little bit more efficacy and results associated with the tirzepatide form of Mounjaro and Zepbound. They seem to have distanced themselves, and so the market has really rewarded Eli Lilly for this. So it's really exciting. Although the multiple is pretty significant here, and I think it's investors showing that they're betting this weight loss boom is going to be here for a long time to come. So it's really exciting.
It's not going to be flat, right? Like there's so many Americans living with overweight and obesity that I think the last I heard was 11% of Americans had been on a GLP-1, but it could be, up to 40, 50, 60%. So that's interesting. It'll be fascinating to see how their revenue is impacted by some of these price drops that they have done. So now, they agreed to lower the prices to $350 a month through Trump RX, give most favored nation pricing to all state Medicaid programs, and Medicare agreed to cover it for qualified patients with a $50 a month copay. So I think they're going to make up for it in volume. And I'm really glad to see the prices come down. And I think we have to also thank a lot of the digital health companies that flocked to this market for helping bring down the cost, because they leveraged, the laws around compounding to meet the demand and prove that there is demand, but we need to make this more accessible. So we'll see what happens with Lilly and Lilly Direct, their D2C telehealth platform, which they've been investing a lot in, and they're trying to just leave out the middleman. So we'll see kind of what happens there. But congrats to Eli Lilly for being the first $1 trillion healthcare company.
It is exciting to see for our industry broadly, and it's certainly well deserved. Not only are the GLP-1s, as we've discussed on this podcast many times, helpful on weight loss, but the research and the clinical data is showing there's so much downstream benefits on reduction of inflammation, right, in the body, and inflammation is a core component of a lot of these chronic disease conditions that we're all what we're seeing Americans in a significant way deal with. So it's going to be exciting. It'll be some of the oral pill forms and some of the other form factors that are coming into play, and some of the new iterations of these drugs. They're going to be really, really powerful. So Wall Street's betting that the engine here is going to keep chugging along, and seems like a safe bet here. Well, Halle, let me turn it down to another area in healthcare. As you probably saw, Oak Street Health, CVS, made a major goodwill impairment charge. It actually took a $5.7 billion goodwill impairment charge after it had acquired Oak Street Health just 2 years ago. It was at the time one of the biggest acquisitions in our industry's history. It still is, of course. It bought Oak Street Health for $10.6 billion. And it's amazing to fast forward today, only 2 years later, and they're effectively taking that $5.7 billion goodwill impairment charge against that $10.6 billion acquisition. So effectively admitting that maybe Oak Street wasn't worth what they had paid. Oak Street was supposed to help CVS serve more seniors through value-based care. Think managing chronic conditions to avoid hospitalizations through their tech-enabled services. But unfortunately, growth just hasn't kept up with projections, and costs, both clinical and operational, appear much higher than expected. Some analysts think it's a case of great on paper, hard to scale. Halle, what do you think?
Yeah. Yeah, I mean, we've had the founder of Oak Street on the show in the past. Great company. I don't know if this just comes down to the fact that acquisitions are really hard. So certainly part of it is just clinics are hard, right? They're expensive to maintain, the brick and mortar piece. They're low margin. They don't scale quickly. And so, unless you nail operations, it's easy to overspend and under deliver. So, we're seeing kind of a pullback from primary care clinics from a lot of these retailers. But I think the bigger one here might just be like, acquisitions are really hard. And I've seen data that says that 75% of acquisitions fail. Like, why? Like, it's interesting because what a big risk then for these acquirers to take. Do they know that there's a 75% chance of the company they acquire failing? And is that priced into these acquisitions?
It's fascinating. Look, I have this unique perch here in watching a lot of these acquisitions of private companies, and I've sort of deduced over time that there are really four impacts that I see. There's just a lot of excitement sometimes around these assets. There's a FOMO effect or a competitive pressure effect, but it's not the right strategic fit for the buyer. It on paper, the deal makes sense, but in reality, the buyer doesn't quite know how to plug the asset into the mothership, if you will. And so they sometimes just overestimate synergies. They have misaligned product roadmaps. Yeah. There's a big one is a big cultural mismatch between the buyer's team and the target's team. So it's really, really hard. The other one, there's sometimes you overpay and there's just unrealistic ROI pressure. When you bake in future performance, unproven revenue streams, aggressive growth assumptions, it's really, really hard for the acquirer to actually hit those assumptions and those numbers. And it was probably unrealistic that the target ever could reach those numbers. So it's really, really hard. Another big one, Halle, just quickly, is integration fails. This is where deals die quickly. I think a lot of teams, buyer teams especially, just underestimate that integration is a silent killer. It's slower, sloppy onboarding of systems, product overlap causing turf wars. We see key engineers leave because of bureaucracy that's suffocating them. It's really, really hard. And so it feels like oftentimes in my experience, the target becomes a project instead of a living business. And so it's really, really hard from that vantage point. And then a final key thing I've just observed in my career is most of these private tech acquisitions, you're buying the talent as much as you're buying the technology and the business. And it's hard when you have key talent walking out. This sort of wasn't what they signed up for. They didn't intend to be or want to be part of a larger organization like that. And so, they start to leave. And so you try to put great retention packages in front of these folks. But if ultimately the culture or politics are misaligned from what the target was to where the buyer is, you see these key talent members and founders bolt for the doors as soon as their non-competes and other restrictions lapse. So it's hard. I mean, integrating, dealing with talent, misaligned expectations, all of this sort of creates a scenario where I think you're right. Statistically, most private M&A doesn't work out the way we all hoped it would.
It's too bad because, we obviously need these acquirers to continue acquiring in order to make the digital health ecosystem go round. But ultimately, like if the acquisitions are happening, but the ROI is not there and they're all getting written down, it's going to stop. Like buyers are going to stop buying. And we've already, I think, seen a slowdown from a lot of these large, like Optum and CVS for other reasons, for balance sheet reasons. However, I do think that, if they start to assess like, well, maybe we're not good at integration and we need to kind of figure out another partnership model that makes sense for these startup relationships. We'll see. I mean, I had a company that was acquired, as you know, because you helped me with that deal. And, 3 years later, they shut it down. So I've been on the other side of that. And it's always hard as a founder because you always think that you know what they did wrong. But, sometimes it's just, sometimes maybe the company wouldn't have worked otherwise. And it was acquired at a time at an inflection point that didn't get realized. You'll never know. But it's always a bummer. It is a bummer, and it's unfortunate. And then you factor in just one final point for our listeners, of course, is the regulatory uncertainty, right? I mean, it's not at this point the most hospitable regulatory environment. Not that the prior administration was any better in this regard, but there's still a lot of uncertainty there, and hopefully over time as there's more clarity around this, we'll start to see more acquisition activity too. But to your point, the fundamental challenge of integrating these businesses and making it work as a collective combined company is not always the easiest. Yeah. And what works early on in a company's life to scale it is not necessarily what works once you kind of get to a certain phase. Totally. So, you need to pull different levers, and sometimes it's like the founder knows best, and sometimes no. Sometimes you really need to be in an environment where there's, more operators. So, okay, I have another bummer story for us. Bring it on. Under the Trump administration's one big, beautiful bill, the Department of Education just dropped a revised list of which educational degrees count as quote unquote professional for the purposes of graduate loan support. And somehow nursing did not make the cut, along with physician assistants, physical therapists, speech pathologists, audiologists. Nursing will no longer be classified as professional under the suggestion, which means that students in these programs won't qualify for higher loan caps under the new Repayment Assistance Plan, or RAP. So the Grad Plus loan program, which has helped cover education costs for years, is being eliminated. And under the new RAP program, grad students will be capped at $20,500 a year, which you got kids in college, that's about the cost of room and board these days. Right. And so, professional students, they will get up to $50,000 a year. So if your degree doesn't make the professional list, your loan support drops. Even if your training leads to licensure, clinical care, national workforce shortage, and nursing organizations are absolutely furious. The American Association of College of Nursing, they put out a statement calling the move a massive step backward, saying it disregards decades of progress toward parity in licensed healthcare fields. There's already a petition out demanding the Department of Ed fix this before it goes into effect in July 2026.
Wow, what a radical change, and talk about disincentivizing folks when we need, in this moment of healthcare shortages, when we need more PAs, more therapists, more nurses. Without a doubt, it's tough. One thing that stood out, Halle, is, as a dad of two girls, I looked at the list and couldn't help but notice the gendered impact. The excluded degrees, nursing, social work, counseling, among them, are statistically largely dominated by women, while most of the ones that are still funded and classified under the professional category skew male. It's a bummer. It's a bummer.
A lot of people are wondering how they picked the degrees. They were not transparent about how these degrees were selected. For example, theology degrees are still considered professional. And so you have to wonder, how is a pastor deemed more professional than a nurse practitioner?
Yeah, where was the line?
Yeah.
I'm not going to try to explain it, but that just is an odd choice. But it's crazy. So just to be clear, you could be training to manage ICU patients or perform physical rehab after a stroke, but because your degree isn't on this bureaucratic list as professional, you get half the loan support as a future lawyer or a theologist.
Yeah, no, and my niece is in an occupational therapy program right now, and the students are panicking. The irony is wild. We keep hearing about the provider shortages, and our healthcare system struggles to staff these clinics, and yet we're making it harder for students to enter those careers. So, I think this is a huge mistake, and I hope that it is remedied before it goes into effect. A lot of people are speaking up. So I'm hoping that the administration will listen and go back on this, because we need as many smart people as we can get to fill these roles.
And it's scary because the shortages are only going to be amplified right over time. So we just need to get, especially nurses.
Totally. Yeah. People keep commenting. I see a lot on social media of okay, in 2020, we were heroes. You called us heroes and clapped for us. And now you're saying my job is not professional. It's really insulting. Very, very insulting to these people who work really hard and have dedicated their career to making healthcare better.
And a fundamental backbone of our healthcare and our healthcare system. So, well, I'm going to switch us over to maybe a little more positive note. You may have seen this, Halle. OpenAI is exploring consumer health tools amid a major healthcare push. It's OpenAI's announcement that they're going to explore entry into the $5 trillion healthcare industry, evaluating consumer applications such as personal health assistants or data aggregators to manage medical information. The healthcare strategy is being led by none other than our dear friend, Nate Gross, co-founder of Doximity and of Rock Health, and one of the original OGs in our sector, and Ashley Alexander, a former Instagram executive. And it really is signaling a major expansion by OpenAI beyond its traditional focus of AI infrastructure. As many of our listeners know, OpenAI reaches around 800 million weekly ChatGPT users.
Wow.
Many of whom seek medical guidance, indicating strong consumer interest. I don't know, Halle, if you saw the other article in the New York Times last week about Dr. ChatGPT, but a fascinating read for our listeners about how patients feel more connected to their ChatGPT engagement than they do with their own doctors.
Well, it's trained to tell you what you want to hear.
Yeah. So it's truly fascinating. But investors see OpenAI potentially succeeding where Microsoft, Google, and Apple struggled in creating a personal health record. And those companies, as you know, really struggle in that regard due to past privacy and data fragmentation challenges. Regulatory changes, too, on top of this, such as the federal ban on information blocking, preventing patients from accessing their data, improving patient access to records through compliance is inconsistent. So we're definitely seeing some companies, intermediaries like Health Gorilla and Particle Health really help standardize a lot of these data sets, which should help in that regard. Today, though, OpenAI is not encouraging users to upload medical records and emphasizes that its model should not replace, of course, professional diagnoses, focusing instead on general health information. So, there's just a lot here. One other thing that caught my attention was, the company does plan to partner with third-party apps, wearables, and pharma companies, including Eli Lilly, who we talked about, our first $1 trillion healthcare company, and Sanofi, as well as other health tech firms, including they published a recent post about their partnership with Penda Health to help develop these AI tools and clinical solutions. So it feels like OpenAI is really moving in an exciting direction here and beyond consumer-focused products and is looking to leverage software for clinicians and health systems, signaling an intent to really engage across our entire healthcare spectrum. So I'm really, really excited. It'll be interesting to see where this all shakes out, but having them take a swing at this is going to be interesting. And there's no one
Nate
better,
was a
and no
huge
one
hire.
I trust. Yeah, no one I trust better than Nate Gross, Dr. Gross, and he's terrific.
I was catching up with him last week and my visit to San Francisco, and again, begging him to join the show. Nate, if you're listening, join the show. He says he has nothing to share yet, but once he does, he will join.
We are holding you to that, Nate, as you're listening.
I mean, it's inevitable. People are using this tool for health reasons to actually create an ecosystem where that can be done safely and appropriately. Makes a ton of sense. So 2 weeks ago, we had the Open Evidence co-founder and CTO on the show, and it was probably the most talked about episode we've ever done because I asked him, why isn't Open Evidence available to patients? And his answer was that it's because doctors don't want it open to patients, which was fascinating, created a ton of dialogue. We went viral on TikTok, which we're barely on. We got more comments, more downloads. We have a right to information that will help us make good choices and good decisions and understand our bodies and our conditions. And gatekeeping is such a thing of 2024. 2025 is just, and forward is just all about giving more power to the consumer, the healthcare consumer. We can debate on another episode using the word patient versus consumer, but at the end of the day, we're paying for it. So I'm going to say consumer. And so, I told him on the episode, I said, if you don't do it, someone else will. And I mean, obviously OpenAI, it makes sense for them to be building out more healthcare capabilities because all of these companies are built on OpenAI anyways. So it makes a lot of sense. And hopefully when they have more to share, Nate will join us and share it live on the show.
That will be a great conversation. And Nate, one more plug, please, please, please.
And Nate, and just for the record, Nate is still on the Rock Health board.
He is I have the privilege of sitting in those meetings with him. He is a fountain of wisdom and just has seen it all, whether it was co-founding and helping to scale Doximity, obviously all his work for the last 15 years at Rock Health and before that. And I think OpenAI got a real gem in recruiting and bringing him on board.
Oh, yeah. Yep. All right. Well, I'm going to take us home with the last story, which is another downer. I claim
what is a bah humbug? What are we today? We are bah humbug.
I know. I claim to be a healthcare optimist, but I'm all, these stories are just so good. All right. So we have another big digital health scandal. The founder and CEO of Dun Global, Ruthia He, and the company's clinical president, David Brody, were just convicted by a federal jury for running what prosecutors call one of the most egregious abuses of telehealth to date. This company, if you are not aware of them, they offered online ADHD evaluations and prescriptions to stimulants like Adderall, but prosecutors say it was really just a pill mill disguised as a startup. And so the DOJ says they made over $100 million by pumping out over 40 million pills, relying on ultra-fast video visits, autofill refill systems, and nurse practitioners who renewed the scripts without actually seeing patients. In one case, at least, the system kept refilling Adderall for a patient who had died. They also allegedly spent $40 million on deceptive ads, convincing people they had ADHD, especially during the pandemic, while blocking their providers from actually doing thorough evaluations. Their incentive was just to keep on pumping more pills because that's how they get paid. So they incented their providers to do so. Meanwhile, they lied to insurers. They falsified clinical records. They submitted fraudulent prior authorizations, false claims to Medicare, Medicaid, private payers. And then when the feds started circling, they tried to move operations to China, transferred money to a shell company, They had some Google searches for non-extradition countries. They probably...
Well, we all do that regularly.
Right, we all do that regularly. They just had to look up
no
Ubiome, right? That's how the Ubiome founders ended up in Germany, and they were caught trying to leave the country. So now they face up to 20 years in prison and are scheduled for sentencing in February 2026. This will be, from my count, the third group of digital health founders going to jail after Outcome Health and our favorite Theranos, which isn't technically, I guess Theranos isn't digital health, but healthcare founders in our space.
Healthcare. Gosh, it is such a bummer because the old phrase comes to mind, of course, one bad apple ruins it all for everybody here. And I guess 3 bad apples in this case, but it is a real shame and contributes to this horrific situation the crisis we're dealing with here in our country with addiction to these types of stimulants and prescriptions. So a real travesty. And then continuing to refill prescriptions for a patient who had passed away.
Yeah.
I mean, it's that's just, and I know things can happen, but it feels like it was all very deliberate here. Pump as many of these pills, get them out of the market, get reimbursed. Yeah, just
they needed Tyler to come in and help them.
Here, Tyler.
Yeah. I think,
what a bummer.
Yeah, I think most digital health founders go into this to do good, but occasionally people come in just to make money. And there are unfortunately a lot of icky ways to make money in healthcare. There are a lot of shortcuts to take. And I think people are more likely to try to take those shortcuts when they are under pressure of investors who expect growth at all costs.
Totally. And look, in my 25 years of doing this now, Halle, one thing has been true. Founders who are solely regardless of the sector, that are just looking to make money are never going to be as successful as those that are trying to change the world, right, for the better. And I've just seen the passion, the commitment, the dedication, the willingness to crawl over broken glass to see those visions succeed. Yeah. Yes, the money is a nice benefit, but that's not what motivates them. And so when you see founders like this that clearly seem to have been motivated by money, it's just in my experience, not always, but bound to at an extraordinary clip, bound to fail. So it's just tragic for the patients that were addicted to this, tragic for our system, tragic for the fraud and waste of taxpayer money. It's just a horrific confluence of just horrible things here.
Mm-hmm. Agreed. I would actually be interested in having one of the founders on the show at the right time, only to kind of talk through, like, how did this happen? Like, now that they're reflecting on their actions and hopefully remorseful for the decisions they made, maybe there's some key learnings that would be helpful for others to hear as a cautionary tale. So, Ruthia, if you're listening, this is an invite to tell your story on the Heart of Healthcare podcast.
And maybe have to override your counsel's recommendation here.
You don't think their lawyers are going to let them? Okay, after down the road.
Down the road.
Awesome. Well, Michael, we had a good year.
It was a very good year. I mean, it was exciting here on Heart of Healthcare. I was so touched and so humbled by the incredible guests we had, Halle, the amazing listeners, the engagement from the community. Look, rarely, thanks to you and Steve Krause, rarely does a lawyer have the privilege and the opportunity to participate in something like this. So for me personally, I just want to thank you and Steve and all our listeners for indulging a crazy lawyer and allowing me to be a small piece of this. But it's been a great year and really excited about 2026. Despite some of the macro headwinds, it feels like it could be a real breakout year for our industry. And
we have some great guests lined up. We have VCs like Emily Melton, Hemant Taneja, Annie Lamont, and some really interesting CEOs like the CEO of Datavant, GoodRx, Function Health. So definitely subscribe. You don't want to miss any of these excellent episodes that are coming up.
Great to see you as always, Halle.
All right. Bye, Michael.
See you soon.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Halle Tecco and hosted by Michael Esquivel, Steve Krause, and Halle Tecco. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and details.
Wherever you go, whatever they get into. From chill time to everyday adventures, protect your dog from parasites with Credelio Quattro. For full safety information, side effects, and warnings, visit CredelioQuattroLabel.com. Consult your vet or call 1-888-545-5973. Ask your vet for Credelio Quattro and visit QuattroDog.com.
With so many options, why choose Arizona State University?
For me, the only online option was ASU because of the quality. Their faculty was really involved with their students and care about your personal journey. The dedication to my personal development from my professors, that's been extremely valuable to me.
Earn your degree from the nation's most innovative university. Online. That's a degree better. Explore more than 350 plus undergraduate, graduate, and certificate programs at asuonline.asu.edu.